Infectious endocarditis, i.e. 1. Pathophysiology. Infectious or bacterial or infective endocarditis is an infection of the inner lining of the heart chambers and heart valves endocardium. It occurs when bacteria, fungi, or other microorganisms enter the bloodstream and lodge in the heart, particularly on damaged heart valves, artificial valves, or other heart devices. This condition can lead to serious complications, including heart failure, systemic emboli, and death if not treated promptly. 2. Onset and duration. 3. Prevalence. 4. Prognosis. 5. Signs and symptoms. Fever and chills. Heart murmurs. Fatigue. Shortness of breath. Chest pain. Petechiae. Osler's nodes. Janeway lesions. Splinter hemorrhages. Roth spots. Arthralgia. Weight loss. 6. Complications. Heart failure. Embolization. Stroke. Pulmonary embolism. Splenic infarction. Renal infarction. Infections in other organs. Valve destruction. Sepsis. 7. Causes. Infectious endocarditis is typically caused by bacteria, but fungi or other microorganisms can also be responsible. Common causes include about bacterial infection, Staphylococcus aureus, Streptococcus viridans, Enterococci, Hayseck organisms, fungal infection, intravenous drug use, prosthetic valves or devices, congenital heart defects, recent surgery or medical procedures. 8. Tests and diagnosis. Diagnosing infectious endocarditis involves a combination of clinical assessment, imaging, and laboratory tests. The Duke criteria is commonly used to confirm a diagnosis. Diagnostic steps include blood cultures, echocardiogram, transthoracic echocardiogram TTE, transesophageal echocardiogram TE, electrocardiogram ECG, chest X-ray, blood tests, complete blood count CBC, inflammatory markers, renal function tests, urinalysis. 9. Treatment and medications. Treatment for infectious endocarditis requires aggressive therapy to eradicate the infection and manage complications. About lifestyle changes. Rest. Prevention. About medications. Antibiotics. Penicillin or ampicillin. Vancomycin. Gentamicin. Ceftriaxone. Antifungals. Surgery. 10. Nursing points. Monitor for complications. Monitor vital signs. Administer antibiotics. Education on dental care. Prevention education. Pain management.